Today we come together for World No Tobacco Day to remember the damage tobacco causes in this campaign, Breathe Free Unmasking Tobacco Store, organized by Voice of Healthcare and supported by Empure Pharmaceuticals. Tobacco remains the leading cause of preventable death in India, claiming over 1.35 million lives every year. This isn't just a health issue, it's a fight for public awareness and strong policies. By spreading early awareness, sharing medical knowledge, and involving the community, we can change how people think about tobacco and protect future generations from its harmful impact. To discuss this, we have with us Dr. Shyam Aggarwal, Chairperson, Medical Oncology, Sir Ganga Hospital and Research Center. Welcome, Dr. Shyam.
Thank you, Dr. Manisha, for this interview.
Sir, to begin with, could you share what World No Tobacco Day personally and professionally means to you as a medical oncologist? And in your clinical experience, how often do you encounter patients whose cancers are directly linked to tobacco?
So thank you very much, Dr. Manisha, for this interview. As a medical oncologist in India, tobacco use is rampant all across the country, and we see a large number of patients suffering with cancer, which are associated with tobacco use. So safely one can say that more than 50% of the cancers which are occurring in our country are related to either tobacco smoking or tobacco chewing or using tobacco in one form or the other. It's a huge menace, which is preventable, because if you start if you stop the production of tobacco, then all these cancers which are associated with tobacco use will not be there. The common cancers which we see in our country related to tobacco are oral cancer, larynx cancer, and if you go down, esophagus or food pipe cancer, stomach cancer, urinary bladder, kidney, acute myeloid leukemia, cervix cancer. So nearly 16 cancers associated with the use of tobacco. Uh, the most important being, of course, the lung cancer, because if you see 100 patients of lung cancer, nearly 90 out of 100 will have history of smoking tobacco, which can be in any form, whether it is cigarette or bidi or hookah or cigar, etc. So tobacco, when smoked in any fashion over a period of time, especially like 10 cigarettes a day for 20 to 30 years, increases the incidence of lung cancer. So basically, the use of tobacco in our country starts at a very young age. In adolescence, in schools, maybe by the age of 10, 12 years, when, these children, they get addicted to using tobacco in any fashion. So it's a huge problem all across the world, and particularly in our society. The difference from the Western countries is that we see a lot of chewing of tobacco, which can be kani or pan masala, which contains tobacco, or you can even sniff it. And therefore the incidence of oral and larynx and cheek and pharynx cancer is extremely high in our country, which is not there in the Western population, because they only smoke. They don't chew, or they don't, keep the tobacco in their oral cavity. So that's a little difference between India and Western countries, and that's the reason that we find oral and larynx and cheek cancer very, very high. Almost 40% of these cancers which are occurring in our country are related to tobacco chewing. So we are dealing with these patients in advanced stage. because a lot of illiterate and poor people are addicted to tobacco chewing, and they are usually malnourished. They present to us in advanced stages, and they have a dismal outcome because we don't have remedies to cure them. Surgery and radiation are the mainstay of curative treatment today, but then most of these patients, being poor, living in rural areas far off, they come in very, very late stages. So that is our problem at this point in our country.
Right, sir. So lung cancer is definitely, on increase, because if we are smoking 10 cigarettes for 20, 30 years and eating, canny or even sniffing it, that could lead to cancer. Sir, there is also a big issue of passive smoking, like secondhand smoke, and we often hear about it. So what are the concerns for passive smokers, especially in household with children or elderly?
Right. So basically, passive smoking means that you are not a smoker by yourself, but in the room or in the house or in the working environment where you live, your friends, your relatives, or your customers are the smokers, and you are forced to, stay in the same room or in the same environment, and that is why you are forced to inhale the tobacco products which are exhaled by the smoker. So basically, all the contents of the tobacco, although maybe in lesser quantity, are inhaled by the people who are in the room or who are in the vicinity of a smoker, and therefore they're also prone to getting the same problems which the smoker is. For example, one can get lung conditions like bronchitis or chronic obstructive pulmonary disease, asthma, and so many other problems which are associated with tobacco, which can relate to heart problems, stroke, and if somebody is pregnant, then pregnancy related issues. The child birth can be small. So the harm of passive smoking is as much as the harm to the active smoker.
Right, sir. So passive smoking is again one issue which we have to, look into, especially if the children they are around. So we are seeing a rise in the use of e-cigarettes and smokeless tobacco as well among young people. How concerning is this trend in terms of future cancer incidents?
Right. So, first one needs to understand what is e-cigarette. So basically, e-cigarette is it's a battery operated product, and in which it's basically in the vapor form. The product is inhaled by the smoker, and by and large, in the product which is inhaled, it's called actually vaping. It doesn't contain, it only contains nicotine, so which is the most addicting part of the tobacco. Because if you split tobacco has two components by and large. One is nicotine, and the other is products which are associated with cancer causation. So in e-cigarettes, there is no by and large those carcinogens which are directly associated with causing cancer, but nicotine, and there are certain other chemicals which can damage the lungs of the individual who is using e-cigarettes, and therefore all kind of e-cigarettes have to be very, very carefully sort of promoted, because the idea is that if you use e-cigarettes and use only nicotine, you are not actually smoking the carcinogens, but still, e-cigarettes are harmful to the lungs of individuals because of nicotine addiction and certain other chemicals which are present in the e-cigarettes. I must say that over a period of time, e-cigarettes have increased because people who want to give up smoking cigarettes or bidi or cigar, etc., they take on to e-cigarettes, and the incidence of e-cigarettes is rising, but it is not absolutely safe. the cancer incidence may be lower, but then the other issues of addicting to nicotine and other lung conditions like chronic obstructive disease, etc., are high.
Right. So only thing is that they don't have the carcinogen, but definitely it could lead to coronary obstructive pulmonary disease or many other harmful
Lung
conditions
condition.
as well. Right, sir. So what kind of early symptoms should young tobacco users watch out for, and how can early screening play a role in intervention?
Right. So anybody who is using tobacco has to be extremely, extremely careful. Ideally, one should stop tobacco use. So there are two kinds of damage which can happen to tobacco users. One is the damage to the oral cavity, people who are chewing, and the others are those who are smoking tobacco in any form. So people who keep the tobacco under their tongue, in the cheek or in the oral cavity, so they are predisposed to developing submucous fibrosis or precancerous conditions like leukoplakia, and therefore they need to go to their doctor if they have those kind of signs appearing. And I think there's no real treatment for these conditions other than stopping tobacco use. At the first instance of developing these kind of symptoms, like a white plaque or a whitish patch in the oral cavity, or fibrosis will result in the reduced opening of their mouth. So, I mean, they have to just go to the doctor, and I think they have to be told that you must stop using tobacco. The second is the smoking part, in which people are prone to developing lung cancers, and patients who have a history of 20 or 30 years of smoking, if they have a symptom of cough or some kind of a respiratory difficulty, so low dose CT scans are recommended after the age of 40 years, every year for 5 years, and one can pick up early lung cancers. And there is data to support the use of low dose CT scans in high risk people who are heavy smokers and who have symptoms pertaining to the lung. So so I think prevention is better than cure. uh, but yes, it is a lifestyle disease, because people do get addicted to tobacco use in early age, and it's not easy to quit smoking unless they go through some kind of de-addiction programs. And you do have options of switching to nicotine, chewing and chewing gums and so on, and going through sessions, because it does require a lot of effort to quit smoking.
Right, sir. So definitely we can, use low dose CT for especially those who are at risk of developing lung cancer and those who are heavy smokers. And especially we should look out for leukopenia or early symptoms because early detection is very important. We should definitely say no to tobacco. That's the best part, and that is what we are up to. So, can you share a story of a case um, where quitting tobacco drastically improved a patient's cancer outcome or quality of life?
Right. So you have to understand that if somebody quits smoking, it's not that the changes which have occurred in his cells of lung or in the oral cavity will revert overnight. So basically, tobacco contains several carcinogens, like tar, or arsenic and cadmium and heavy metals, and certain other polyamines, etc., etc. So basically, they when you use them for a long period of time, they will damage the DNA in the cells, which are lung cells or in the oral cavity. And if there is a abnormal cell, so their repair mechanisms also go bad, and there is weakened immunity, and that is why they develop cancer. So what I'm trying to say is that if you quit smoking today, so these changes are not going to disappear in a span of 1 month or 2 months. It actually takes 5 years to 10 years for a smoker to come back to a stage of a non-smoker. So you can't expect miracles by stopping oral tobacco use or smoking tobacco, because it really takes time for people to come back to their normalcy stage. So you can't have stories that somebody was smoking for 30 years and somebody developed lung cancer or oral cancer, and then he or she quit smoking. So it's not only he, even women are smokers. So and then the moment you stop smoking, and within a span of 1 month everything becomes hunky dory and becomes all right. So no, it is not going to happen. So they're not going to be like a story where you will find somebody becoming normal in a span of 1 to 2 months. So if somebody has cancer, then of course I think what I can say is that in patients who are smokers who develop lung cancer, so we have immune checkpoint inhibitors, that is immunotherapy, which is combined with chemo in advanced stages, and one can expect cures in 20% of advanced lung cancer cases, which was not happening before. Of course, they have to quit smoking along with, and we have patients where people were in very bad shape, who were smokers, who quit smoking. They were in stage 4 lung cancer. We gave them chemotherapy and immunotherapy, and they're living beyond 5 years. And there are several celebrities like that who are enjoying the help or the treatment benefit with immune checkpoint inhibitors, because smokers tend to benefit more from the immunotherapy along with chemo in patients with lung cancer, and not only lung cancer, but also in patients who have oral cancer. So we are saving lives of smokers with cancers by using immune checkpoint inhibitors along with chemo.
Right, sir. So to quit smoking is the best, I think we can do. And if somebody develops cancer, then definitely there are treatments available, like immune checkpoint inhibitors, you are saying. So, how can oncologists and hospitals play a more active role in tobacco prevention beyond treating the disease?
Right. So, each year, 31st May is celebrated as a No Tobacco Day since 1987. So they always, have a theme for the No Tobacco Day. And this year, the theme is Unmasking the Appeal, Exposing Industry Tactics on Tobacco and Nicotine Products. So it's a great theme this year, and the tactics which the tobacco industry uses are by adding flavoring and additives to reduce the harshness of tobacco smoke, so that more people like it and get used to it. Secondly, they do targeted marketing in the form of sleek designs or attractive packaging and digital media campaigns, etc. And third is deceptive product design. I don't need to name what people are doing, what we are witnessing on the televisions and on the screens in the media. So I think the theme this year is to stop these activities, or bring them down, so that tobacco is not promoted as a macho product for people to take it up at an early age. So I think all organizations, including government, including organizations, NGOs, hospitals, should have some kind of display wherever it is possible in the community, whether it is a hospital, whether these are airports or railway station, public places, and so on, where promoting the use of tobacco sale should be curtailed, and it should not be shown as a very, as I repeat here, as a macho product, so that people should not, especially the younger ones at the age of 11, 12, 13 years, should not take up the madness of tobacco chewing or tobacco smoking, because the longer you take it, the more you take it, more is the incidence of developing not only cancers, but also heart conditions and stroke, lung conditions, and pregnancy related problems and so on. So it's a huge problem. I think I mean we do have certain regulations of not selling tobacco around schools and colleges, but they need to be adhered to. I mean that needs to be implemented, and so implementation of such kind of schemes is extremely important from all quarters of life.
Right. I think the younger generation, they are more addicted and they feel it's a macho product, as you said. And this is what should be, curbed and what should be looked into. So I would like to ask you that what message would you like to share with viewers, especially youth and caregivers, about the importance of saying no to tobacco?
So I think we need to popularize the side effects or the bad effects of tobacco using from our schools. It should be in the textbooks. The teachers should be talking about it so that the young children or the youth they don't start or don't take up the use of tobacco in any fashion. So I think it needs to have a political will behind it. Only then things can change. The biggest problem is that it's a huge source of revenue for the government, not only for India but for all over the world, because tobacco is grown and it has its own problems in growing, but then it is a source of revenue. And unfortunately, the growth rate for tobacco industry is to the tune of 4% each year. It's not that the messages of prohibition or other methods which the governments are taking, that the tobacco production will decline. So it is not declining. So the tobacco industry is continuing to rise in spite of our understanding of the bad effects of tobacco. So I think something needs to be done from the government, from the NGOs, or from the institutions, so that I mean the farmers should be encouraged to stop growing tobacco and switch to another crop which is equally paying. Because states like Andhra Pradesh, which are number one, and India is actually number two in the world in terms of tobacco production. So one needs to have a different perspective so as to stop the menace of tobacco, and everybody has to contribute in that direction. Thank you very much.
I think this is a very good message that we should not grow tobacco and say no to tobacco. So thank you so much, Dr. Shyam, in joining us for this
Thank you.
discussion.
Thank you, Dr. Manisha. Thank you very much.